It's day 3, and as you can see, I'm on the road. My son Tim has driven all the way from Fareham to pick me up in Windsor, and now he's ferrying me all the way up to Grantham. Well, that was quite some journey home. I'd been really well looked after by the staff at the Princess Margaret Hospital in Windsor. I did mention the nurses, but right from the porter taking me to my room, the catering staff, the cleaners, everybody was really proactive. And even when the catering staff realised that I wouldn't be staying for lunch, they came in and asked me if they could make me a sandwich to take with me, which was really, really nice. But of course now I had to leave that protective cocoon and go home. And it was obviously going to be quite different. The physio had recommended that I stop at least once on the way home and get some circulation back in my legs. And we decided we'd stop at the services on the A1 at Baldock. And by then I needed a comfort break as well as some food. And of course, with these motorway services, you know, the toilets are right at the back of the services. So you've got to go through all the food outlets and so on with the inevitable queues. I was going down there at a snail's pace, as you can imagine. It was the longest walk I'd done on these new knees. And I suddenly realised how vulnerable disabled people feel. There were kids running around chasing each other. There were people pushing around and turning around without looking. And it did make me feel quite vulnerable. Fortunately, I also saw the good side of people, because parents were telling their children to be careful and other people were moving out the way. Some of the staff stopped doing what they were doing to let me by, which was nice to see. It was a whole new view that I wasn't used to. I'm not used to feeling vulnerable. But of course it was great to be home. My wife took over the care and she is an absolute angel. She won't appear on these videos. She's a very private person, so you will never see her, but rest assured she was extremely caring, and in fact at times she was actually doing more than she needed to. I was absolutely exhausted that night, so we got set up. Tim helped us set various bits and pieces up that we needed, and I went to bed at 7:30. I was so tired. Unbelievably, I slept for 12 hours straight, which was brilliant, but I can say it wouldn't last. For the next 2 weeks, every 2 hours I woke up. It was a case of every 2 hours waking up, needing the toilet and needing to change position because it was getting uncomfortable. Sleeping on my back was the only option I had. I certainly couldn't stand the discomfort of laying on my side. And of course, for me, and maybe many others, sleeping on my back meant one thing, and that was snoring. Now, fortunately, my wife had moved into the West Wing, so she was giving me plenty of space and she didn't have to suffer the snoring. Now, by the time I woke in the morning, I was very stiff, and mobilising was extremely difficult because by then swelling had set in. Also, I'd been pretty immobile all night. And although I had 110 degrees of bend in hospital, by now it was tough getting even 90 degrees, and this was due to the swelling. Now, I was mindful of the surgeon's warning, and that was that I'd had 2 major operations. So the first 2 weeks, healing was just as important as mobilisation. But mobilisation is really important because you have to avoid scar tissue building up. And if it is allowed to build up, that's going to cause some problems later on. And as I've said, first thing in the morning was probably the worst because it was just getting moving again that was quite difficult. But I quickly discovered a technique that worked for me. What I used is gravity to allow the lower leg to fall naturally. So I laid back, held my upper leg up and just allowed my lower leg to fall naturally. And I found this much easier than pulling it to get going. It just was a nice, easy, natural start. I did check this with the physio and he said it was absolutely fine. So if it's something you're having problems with, I would suggest it's worth trying. But of course, in my case, I had to repeat this for both legs. Now, some people thought I was making a mistake having both knees done in the same operation. And I have to say, I haven't regretted one moment of it. It was clearly the right choice for me. And partly I think it helped because I couldn't favour a good leg and gingerly put the weight on the operated leg. I had no choice but to stand on them both. And doing that, I realised that standing on them both wasn't an issue at all. Now, in terms of mobilisation, I followed the physio's instructions with 2 to 3 sessions of stretching per day. And you can see the sort of stretching I was doing. And as you'll see here, just in a few days, I was back to that 110-degree flex. Now, I didn't always do 3 sessions a day. Sometimes I only did 1 session a day, and that's because I was listening to my body. If I really didn't feel like doing it, then I didn't do it. But other days I would do a little bit more, and I'd certainly get the 3 in, because I was mindful of the surgeon's comments that these were 2 major operations and they would take time to get over. I'd also mobilise whenever I was sitting down, say at the dining table. I would do exercises with my legs just to keep them moving. And after every exercise session, I would have a 20 to 30 minute session of icing. And these ice cuffs were supplied by the hospital for me to take home, and they'd relieve any discomfort and obviously help reduce the swelling. Because I lived 3 hours away from the hospital and clearly I couldn't drive, the physios did some online sessions with me. I was able to show the physio what I was able to do, and he was giving me advice on improving the movement and so on. And one of the things I found is that because of the muscle pain, it was difficult to actually lift my leg just with the muscles alone. It was putting quite a strain on the muscles. So I used a resistance band, and I was popping that around my foot and pulling my leg back with that. Now that worked very well, and I showed the physio when we did one of our online sessions, but he told me I was doing that wrong because my foot was coming off of the floor and it meant that I was putting a lot of strain on my hips. So he recommended that I put the resistance band around my ankle and pull back, and that would make sure that my heel would stay on the surface. Every day saw improvement until one day I realised I'd walked to the kitchen without crutches. Now obviously I had things that I could get hold of if I was starting to fall, but it was just a natural reaction that I got up and walked through there. Stair climbing also got easier, and I could take 1 step after another instead of going up 1 step at a time with both legs. Now this is where we need to talk about pain. And before I say any more, I think we have to appreciate that pain is a very subjective thing. What one person would call pain, say on a scale of 1 to 10, they say they're a 9. Somebody else would probably say it's a 5. So it's a very difficult thing to talk about. And I have to say, I know some people that have had excruciating pain from knee replacement. In fact, my neighbour, who's a very good friend, when I asked her about pain, her first comment was, "Do you really want to know?" And she likened it to childbirth. Now, obviously, I've never experienced childbirth, but I've watched my wife giving birth twice, and I realised how painful it was. Now, for me, I would say my baseline of pain is, for example, the dentist. I once was landing on a flight and all of a sudden I had this incredible pain in my jaw, and it turned out to be an abscess, and I had to spend 2 weeks of a holiday in Florida in enormous pain. So I understand that. That's pain, and that pain you get from a long-standing toothache, for example. But I guess I can stand a certain amount of pain. For example, if I go to the dentist for a fill-in, for example, I don't have an injection because with my work I had to talk, and I really couldn't have 3 or 4 hours of dribbling frozen mouth. So I preferred to do it without an injection. And in fact, most of the time I found it less uncomfortable than the injection itself. Many years ago, probably about 20 years ago now, I was in a warehouse and I slipped over on some oil and I went down on my hand, and this little pinky finger was actually sitting out sideways. It was almost 90 degrees to where it should have been. I was 3 hours from home. I was the wrong side of the River Thames on a Friday afternoon, and I knew there would be enormous traffic later on, and I really wanted to get over the river and get on my way. But of course I was going to have to go to A&E, and it would take me probably 3, 4, 5 hours before I'd be treated. Now, I'd watched enough of these helicopter rescue programs to know what they do when there's a dislocation. They pull it and they pull it back into place. But of course they always administer gas and air and that sort of thing. But I thought, well, might as well give it a go. And I literally just pulled my finger and then pushed it back into place, and it just slotted back to where it should be. And I can honestly say I didn't suffer any pain. It was a bit uncomfortable, but of course the adrenaline was still pumping, and I guess that helped. Now, I'm not some kind of hero, it's just that in the moment that's what I decided to do. But I think that gives you an idea of where my pain threshold is. So having said all that, what I have to tell you is that I didn't have any pain at all. Yes, I had discomfort. Yes, I had aches and that sort of thing, but I honestly didn't have anything that I would term as pain. Now, of course, for the first certainly 2 weeks, I was taking codeine and paracetamol, and I took them regularly on time, and that obviously helped with the discomfort. I stopped taking the codeine after week 2, and I found that the paracetamol was extremely effective on its own. Most of the discomfort, I would say, was from the muscles. Now, clearly there's a certain amount of trauma to the muscles during the operation, and I did find them very, very tender. There was also quite a lot of bruising came out. In places I didn't expect them. There was bruising to the sole of my foot, for example, and my upper thigh was bruised. Nothing around the knee at all. And that I found to be uncomfortable. And certainly when I was sleeping, the discomfort would wake me up, but it certainly wasn't pain, and it certainly wasn't something that I found difficult to live with. So as I've said, I do know people that have had excruciating pain. I've had family members in that situation, so I do know that it can be a very painful operation. So what am I putting this lack of pain down to? Partly it's probably down to what I'm terming as pain. Maybe some others would say this was pain, but it certainly wasn't excruciating or difficult to live with. I think without a doubt the fitness that I gained before the operation made a huge difference. So the cycling that I've been doing, and certainly the build-up of musculature before the op, without a doubt paid off, because I'd already got that flexibility. Now, I realise that some people will have difficulty gaining that fitness purely down to the pain they're suffering from the arthritis in their knees. But cycling doesn't put any strain on the leg at all. So what I would say is, even if you're not into cycling and cycling on the road and what have you, get yourself an indoor bike and get some exercise going, build up those muscles, and do anything you can that doesn't put any stress on the knees, but improves your fitness and improves your muscle tone. I think also, without a doubt, the robotic assisted surgery made a huge difference, and the fact that Mr Bourke, the surgeon, doesn't use a tourniquet, because a tourniquet is known to cause a certain amount of pain. Now, as you could see from the images of the stretching I was doing, the dressing was quite bloody. It wasn't very pleasant to look at, but that had to stay on because that dressing had been applied in the operating theatre in highly sterile conditions. So that had to stay there until it was time for the staples or clips, whatever you want to call them, to be removed. And that was planned to happen on day 16. So that was going to be quite a milestone. Now, each day I'd been improving, I was walking around more, and I was walking around the house without the crutches, regularly doing my exercises and so on. Now, up until this day 16, when the nurse was coming, I'd stuck religiously to the physio's recommendations. I was doing no more. Wasn't sure how the dressing removal was going to go. It seemed, you know, like getting these clips out might be a bit painful, but it wasn't at all. It was dead easy. One of the clips did sting a little bit when it came out, but it was nothing. And you can see from this image that apart from the main dressing, there were two separate dressings, one above it and one below it. And that was where the array is fitted. They drill into the bone and fit this array, and that registers with the robot to make sure everything is calibrated to my specific leg. And it will show the surgeon where he needs to make that cut to get the perfect alignment. The wound had healed really nicely. The nurse was very pleased with it. And she said there's no need to redress it, just leave it as it is. That was fine until I got into bed, and I really didn't like the sensation of that wound rubbing on the bed sheets. So I decided that I'd ask my wife to pop on the spare dressing that we had. That felt a lot more comfortable, and I left that on for a week. And once I removed that dressing a week later, I found I'd got a lot more ease of movement. Now, the physio was really pleased with the amount of movement I had, so he cleared me to try my indoor trainer. Now, he said that I would need at least 120 degrees of flex to actually turn the crank. But to my amazement, once I got on the bike, I was already there. I could actually do a full rotation of the pedals. Now, I do have a shorter crank, which does help, but I found that movement of turning the crank to be so smooth, and it felt extremely comfortable on my knees. Now, I only did 5 minutes to start with, but the physio cleared me to do 2 15-minute sessions a day with absolutely no resistance. And it worked really, really well. And it gave my morale a positive boost. I could see that things were improving. Now, I was instructed to do the 2 15-minute sessions a day for 1 week. And after that week, I could start to add some resistance and time. But that's for next time. So thanks for watching. I hope this is helping those of you that are maybe thinking about knee replacement but are a bit afraid of it, not sure what the recovery is going to be like and so on. Now, I can't speak for everybody, obviously, we're all different, but certainly for me, I wish I'd have done it sooner. I should have done it a couple of years ago, but hindsight's a wonderful thing. But of course, I'm clearly not there yet. There's quite a long way to go before I'm allowed out in the wild on my bike. But join me next time and I'll show you how that goes. Bye for now. It's week 5 and I'm finding myself getting quite frustrated.